Welcome to Politics Now, where we sit down with newsmakers and our elected officials. Today we welcome back to the program Congressman Stephen Horsford of the 4th District. Thanks for being here.
Thank you, Steve.
Let's talk about one of the big issues of the day, of course, is guns. And we have seen a series of mass shootings, all conducted with military-style assault rifles in California, in Dayton, in El Paso. There was a California Highway Patrol officer who was killed with one in Riverside County. Is it time to ban assault rifles entirely?
Yes, it's time to restore the assault weapons ban. We've had over 8,500 deaths just since the beginning of 2019, over 17,000 gun-related injuries, 248 mass shootings since the beginning of this year alone. Over 90% of Americans fully support comprehensive background checks, including responsible gun owners and members of the NRA. And overwhelmingly, Americans support closing the gun show loophole, restoring the assault weapons ban, making sure that we're addressing the high-capacity magazines, which Congresswoman Titus is working on. These are all measures that we need Congress to act on. We've acted in the House on 2 of these measures already, and it's time for Mitch McConnell and the Senate to take action and bring these bills up for a vote.
That's really got to be the frustrating thing, especially for someone like you. You've experienced gun violence in your own life. It's got to be frustrating. You realize you could pass anything almost, and no matter how reasonable, no matter how much support it had in the House, it gets to the Senate and it goes nowhere because the rules are different in the Senate. So how do you overcome that?
We overcome it by the will of the people. I'm proud to have joined the Moms Demand Action and the Students Demand Action just recently, calling for the Senate to do its job. I mean, look, it's one person, Mitch McConnell, that schedules the vote. The votes are there, I believe. I believe that there are enough reasonable-minded members in the Senate who know that we have to get common sense gun safety legislation enacted. I was disappointed that the president on one day said he was willing to work with Congress and work in a bipartisan way, and then he took a phone call from the head of the NRA and then suddenly backed off. This is not a policy that the gun lobby should be dictating. This is about the will of the people and the lives that are at stake. Children don't feel safe going to school. People don't feel safe going to church or their mosque or their synagogue. We can't go to local grocery stores. It's unacceptable, and it's time for leaders to have the courage to do the right thing and pass legislation.
You know, you were once in a position in the Nevada State Senate where you were the majority leader, and you had total control virtually of everything that came to the floor. There were some Republicans who complained their bills didn't get heard, but there were a lot of bipartisan bills that did get heard, and many of the bills were passed with bipartisan majorities. That worked in Nevada. How is it that that can't seem to translate to Washington, D.C.?
Well, Washington is broken, and it's part of why people are so frustrated with the majority in the Senate in particular about them being unwilling to work and act on anything, not just gun safety legislation, but you know, addressing the health care needs of this country, bringing legislation to the floor dealing with prescription affordability, trying to help address income inequality by giving people a raise and addressing the fact that women still don't get paid the same amount as women. These are all bills that we have sponsored and passed in the House that we're waiting on our colleagues in the Senate. You know, my job in the House is to craft the best possible legislation, to work with my colleagues in the House on both sides of the aisle, and to, you know, make the case to the Senate and to the President that these are measures that the American people and my constituents here in Nevada deserve.
You mentioned prescription affordability. I know that's an issue that you have been working on. Your solution to that is a pretty simple one: allow Medicare to negotiate with the drug companies to use that purchasing power to lower those prices. We're going to buy in bulk. We want a discount. The VA does it. Medicare cannot do it by law. What are the chances, you think, of getting that changed?
I feel really good about this measure going forward. Again, it's something that there's pretty much bipartisan agreement. This is a provision that got added when they were working on Medicare Part D, and the pharmaceutical lobby apparently slipped in a provision that said Medicare could not directly negotiate with drug manufacturers for lower cost drugs, even though they are the biggest buyer of prescription drugs. And as you indicated, the VA is able to do it. We're going to pass legislation to strike that language, to give Medicare the ability to directly negotiate. But that's one of several approaches that we're taking on prescription affordability. I'm proud that my bill, the Spike Act, which deals with drug transparency cost, forcing pharmaceutical companies to have to disclose their cost, passed out of the Ways and Means Committee, the committee I'm honored to serve on, unanimously. I worked with a Republican member, Tom Reed from New York. We got a vote 40-0 out of the committee, and now we're waiting for final action on the floor when we get back in September. So that, along with the Medicare negotiation, and then the final piece is capping out-of-pocket costs for copays. The fact that many individuals, even people with insurance, end up getting high-cost copays for life-saving medications that they need, whether that's insulin, heart medicine, cancer medicine, people that have asthma. You should not have to ration your medicine or not take it all because you simply cannot afford the cost of that life-saving medication. So this is the approach that we're taking on prescription affordability, and I believe that we've got to do what's in the best interest of the American people and get this legislation passed.
Yeah, the pharmaceutical companies say that you know, these efforts will stymie innovation, will stymie research. There's still a lot of money to be made in researching new drugs, better drugs than the ones we have now. Do you worry at all about that balance, about whether or not you know, the money may be put into research by Big Pharma if they say, well, we can only make a certain amount of money on this drug?
Well, two things that I respond when that issue comes up. First is I am a proponent of research and development and innovation, and in fact, the federal government invests in that through the National Institutes of Health, and the taxpayers are actually paying for a lot of this invention to begin with, and that's why we deserve a return.
If that happens, if the taxpayers underwrite the cost of the drug, shouldn't it be generic priced at least?
We should absolutely have a role in the way the pricing is set, and to make sure that consumers are not gouged. The second issue that you brought up, which I respond to, is overwhelmingly what we actually hear is that they're spending an inordinate amount of money in marketing and administration costs, including CEO pay, buybacks of their stocks, bonuses to their executives. You know, instead of giving those tax breaks to consumers, that's why we want to balance this issue out by passing the legislation that I brought forward and that I'm working with my colleagues to get enacted.
You know, it always amazes me, those pharmaceutical ads, they're advertising a product that you can't buy. You can go to 7-Eleven and buy a Diet Coke, but you can't go to 7-Eleven and buy these prescription drugs. You need to go to a doctor first. That's why every ad says, ask your doctor if this is right for you. So it's really amazing to me that they advertise so heavily for a product that is basically restricted, that you couldn't buy unless you have that prescription.
This is the #1 issue facing my constituents in the 4th District, and I know it is throughout the state and throughout the United States. Look, I met with a type 1 diabetes young person who is not more than 10 years old, and the child and their mother were explaining to me the situation that if they don't take their insulin, that child will die. And the fact that the cost of insulin has gone up 197% since 2004 is outrageous. This is something that we cannot tolerate. Insulin is not even a patented drug anymore.
Yeah.
I mean, it never was patented. In fact, it's actually the injectables that are patented, and that's how they've kind of jerry-rigged the pricing along the way. Again, the insulin was actually turned over for the cost of $1 by a researcher at the university over 100 years ago. And now we have 3 drug manufacturers who are setting the price, gouging consumers, and not allowing the people who need that life-saving medication to be able to access it at an affordable price. It's unacceptable, and we're going to do everything we can to change it.
While we're still on healthcare, there's a debate raging now on the national stage and among the Congress about Medicare for all. Bernie Sanders, Elizabeth Warren have said we need to give everybody Medicare. It's a great program, low overhead. It'll save a lot of money. It'll save us from some of the things you're talking about, co-pays and deductibles and things like that. Other people say, well, no, this is starting from scratch. We'd have to get rid of all the private insurance, all the union negotiated health care, all of that. You have not come out for Medicare for all. You are sort of in the Joe Biden camp of saying, we have the Affordable Care Act, let's stop trying to repeal it and build on it to cover the few people, well, I say few, millions of people who do not have insurance.
I'm in the Stephen Horsford camp of fighting for my...
So Biden's in your camp, is what you're saying. Okay.
Look, these folks are running for president. I have a job to do right now as a member of Congress. And my constituents who I've talked to about this issue tell me they want to protect the health care that they have now. Over 70% of Americans receive their health care through employer-sponsored plans. Many of these are plans that workers negotiated those benefits. I'm not going to take health care away from the guest room attendant or the cook or the food server who's already fought so hard to get the benefits that they have. Some of those health plans are the best health plans in the country, including better than Medicare. I'm also not looking to disrupt the entire healthcare system. I believe that we need to provide a public option. That's why I support Medicare X. But that's to add an option along with employer-sponsored health care, the Medicare that we have now, the Affordable Care Act, which we need to strengthen and improve on because the Republicans have been sabotaging over the last couple of years, and of course the expansion of Medicaid, which I always commend former Governor Brian Sandoval, the first Republican governor in the country, who enacted that Medicaid expansion. And because of it, we have cut the rate of uninsured people in Nevada by half. Children went from 30% uninsured to now we're below 11%. We still have more work to do, but we cannot go backwards at a time when this administration is in federal court right now, today, trying to take away pre-existing condition coverage. And in fact, they're arguing that the whole Affordable Care Act should be ruled unconstitutional. There is nothing more important that I am fighting for but the health care of the people in my district who need it. Absolutely, I want to provide coverage for those who don't have it, and there's a way for us to do that without disrupting and taking away health care from the people who have it.
Now, you're obviously very passionate about these issues. The cynical viewers out there are going to say, well, he has to say that because his district's a lot closer than, say, Dina Titus's. Her district is super safe, so she can say anything, Medicare for all, impeach the president, anything like that. You have to be more cautious, more pragmatic, and more attentive to the split in the vote in your district because you need a bigger bipartisan slice to get reelected. What do you say to that?
Well, it's not about necessarily the split of my district. My district is half the state of Nevada. I represent 52,000 square miles. I have rural parts of my district, urban parts of my district. I represent North Las Vegas in the Northwest, but I also represent areas like Pahrump and Tonopah, Hawthorne. I'm going out to Ely and Yerington. I have parts of my district that today only have one available provider under the Affordable Care Act, and so their rates are higher. And that's why I'm trying to pass the tax credits to provide the exchanges the relief they need in order to bring down those costs and to provide the competition that's necessary. I want to provide for telehealth in rural parts of my district so that even if we address the access issue, we still don't have enough doctors. One of the biggest concerns I have with Medicare right now today is I have constituents who cannot see an OBGYN because the Medicare rate for reimbursement is so low. There are doctors who won't take Medicare enrollees into their practice.
Not just an OBGYN, even general practice, family practice.
But it's even more acute among OBGYNs. I literally have senior members of my district, older Americans, who cannot see an OBGYN because of the Medicare rate. You're right, it's not just limited to that, but it's something that I hear from my constituents. And so my goal is to strengthen the entire healthcare system for all Americans, for my district, for the constituents who are relying on me to solve problems while we work towards a universal healthcare system. I'm for providing a public option and allowing people to opt into that, to buy into Medicare. But we can do that without disrupting over 70% of the people who receive their health care today through an employer-sponsored health plan. And people also argue, well, that means I'm stuck to that job and I can't leave. There's ways for us to reform that too, so that the health insurance that you have through your employer can also follow you and is portable. So, you know, let's not be so rigid in our thinking. Let's be open to solutions that really work for people. That's what I've always been about. It's not about politics for me. It's about solving problems that affect my constituents every single day.
You mentioned how broad your district is. It also includes Area 51, where next month a planned gathering of people, originally on Facebook, was said that they were going to storm Area 51. And so the government is somewhat concerned about that. I imagine you're being briefed on the arrangements to protect people who go out there and make sure nothing happens when they're out there. Do you have a message for people who are interested in this Area 51 event? Would you like them maybe not to participate, or?
Well, look, Rachel, Nevada, which I'll be going through to get to Ely, is not a place where you want to find yourself without food, without gas, and without housing. And so while there's this kind of excitement around this potential event, I know that the local municipalities are preparing and putting steps in place to ensure that, you know, the life and safety is taken into account in the event that there is a big group of individuals that show up. But, you know, as you know, that area is the NNSA, the Nevada National Security Agency, and so there are critical things that are happening there, and they're important to our entire national and actually global security. And so, you know, my message is, you know, let's be careful about what we do to disrupt anything related to our national security. You know, I have no problem with people promoting tourism and coming out to see certain parts of Nevada, but definitely be prepared if you do so.
Yeah. Bring water and sunscreen. Yeah. One of your other jobs is a project with the Congressional Black Caucus about the census. You are in charge of this project. The administration recently tried, they failed, to get a question on the census that was on there in years past. It hasn't been on there in quite some time, about citizenship. Do you think the publicity around that question, even though the question is no longer going to be on the census, is the publicity around that question going to drive down participation?
I'm concerned about that, and it's one of the reasons I agreed to become the chair of the 2020 task force on the census for the Congressional Black Caucus, and I'll be working with all of my colleagues to try to improve the participation. We've had a census every 10 years since 1790 in this country, and every 10 years we've had certain communities that are historically hard to count communities. Here in Nevada, it's projected that some 55,000 people may not be counted in the census. For every one person that's not counted, that's $20,000 in lost federal funding. Multiply that by 10 years, and it's over $1 billion in lost revenue to the state. And that's in the form of programs like SNAP, Medicaid, housing vouchers under Section 8, grants for small businesses, transit, you name it, you know, any federal program that has an allocation based on census data, it's affected by that count.
Yeah, I didn't realize it was so big. The number is so big.
It's about $800 billion in annual federal funding that gets allocated based on information from the census. So, you know, I'm a member of the Ways and Means Committee. I'm fighting to bring resources to Nevada every step of the way. And so I want to make sure that we get our fair share. I mean, we don't get it now, and we need to make sure that every single person is counted. So we are going to do three things. One, hold the current administration accountable to having a fair, accurate, and complete count. Anyone who lives in the United States at the time of the count in April is to be counted. That's the Constitution,
Yeah.
That's the law. Regardless of status, background, whether you have a person with the ex-felon issue, if you're homeless, multiple children, it doesn't matter.
Yeah.
Everyone has to be counted. Secondly, we're going to work with community organizations and the private sector to help augment what the Census Bureau is doing to encourage people to do their civic duty and to participate in being counted. And then the third thing is we're building a toolkit of best practices for members of Congress on ways that we can educate our constituents.
So that every member could use.
Correct. On why this is important, why the census is important, how it affects our districts. You know, it's not just about representational power in Congress and the Electoral College, which is important, but it's also about this allocation of about $800 billion in funding each and every year.
You've been critical of the president on several areas, just even here tonight, the census question, the Affordable Care Act lawsuit, and other things. He has made a lot of statements recently that have been very controversial. He has been called a racist by a lot of the people who are running for president. Do you think the president's a racist?
Look, what I believe is that the president's policies and his actions speak for the discriminatory and racial beliefs that are held. And that is what's most concerning to me, is the long-term policies. You know, they just appointed the 99th federal judge, confirmed the 99th federal judge in the Senate, while they're taking up no bills to deal with gun safety.
The 99th of the Trump presidency.
Correct.
Yeah.
99 federal judges. That is a generation of judges that are going to set a course of you know, legal interpretation, and many of them, you know, were not qualified. The lack of diversity, no inclusion of even women judges for the most part. And so while we're fighting for gun safety, health care, addressing income inequality, they're here enacting and confirming judges for a lifetime appointment on the bench. Those will have dire consequences on my constituents and the people across this country. And so I just want us to stay focused on the situation and the moment that we are in. Yeah, you know, I'm very concerned, and I believe that this administration has to be held accountable. No one is above the law. And while Congress does its oversight and accountability function, we also have to legislate on the things that the people elected us to legislate on.
And it sounds like you're doing that. I mean, it sounds like the House is passing laws, at least, and over to the Senate.
Well, you wouldn't know it if you just, you know, watched certain national newscasts, and the focus tends to be either on the president or on a few members of Congress, rather than the majority that are working hard every single day to try to advance important legislation for our constituents.
And not to play into that, but let me ask you this. The question of impeachment has come up. One member of Nevada's delegation has joined what I now think is a majority of Democrats in the House, saying the president ought to be impeached based on the things he's done, the findings in the Mueller report of obstruction of justice. Even though collusion was not established, obstruction of justice, there were several acts that could be construed as obstruction of justice. You have not called for the impeachment of the president. What is your view on that?
Well, I haven't taken impeachment off the table. We have 2 House lawsuits pending against the administration, one of which it relates to the committee I serve on, Ways and Means, dealing with the tax returns. There are more than a dozen congressional investigation hearings that are occurring. You know, I've read the Mueller report cover to cover. I know the conclusions that are in that report. They are serious, they are damaging against this president. What I want is for Congress to complete its oversight and accountability, and to allow the outcome of those findings to be reached so that when and if we take action, we do it in the most thorough and complete way possible with the grounds that really do rise to high crimes and misdemeanors, which is what is called for in the articles of impeachment.
From your reading of that report, do you think the president has committed crimes?
He federally obstructed he obstructed in a federal investigation on several occasions, and that's well documented throughout the Mueller report and confirmed through his testimony before Congress.
So if articles of impeachment were passed on that subject, that's something you would consider voting for?
I have not taken it off the table.
Okay, sounds good. Well, Congressman, thank you very much. I know you're busy. You're on your way up to Rachel, on your way up to Ely, parts north. You've got a huge district, putting a lot of miles on your car, no doubt. But we appreciate having you here on Politics Now. We hope you come back soon.
Hey, I really appreciate the opportunity to be on, and congratulations to you and all of your success, and I look forward to being back anytime you have me.
Sounds great.